Diabetes mellitus is a chronic metabolic disorder characterized by elevated blood glucose levels due to the body's inability to produce or effectively use insulin. There are several types of diabetes, including type 1 diabetes, type 2 diabetes, gestational diabetes, and other less common forms. Type 1 diabetes is an autoimmune disease in which the immune system destroys the insulin-producing cells in the pancreas, leading to a deficiency of insulin production. Type 2 diabetes is a metabolic disorder characterized by insulin resistance, where the body's cells become less responsive to insulin, leading to hyperglycemia. Gestational diabetes occurs during pregnancy and usually resolves after delivery. The causes of diabetes are complex and multifactorial, involving genetic, environmental, and lifestyle factors. Predisposing factors include obesity, physical inactivity, poor dietary habits, age, family history, and certain medical conditions such as hypertension and dyslipidemia. The signs and symptoms of diabetes include polyuria, frequent urination, polydipsia, excessive thirst, polyphagia, increased hunger, weight loss, blurred vision, fatigue, and slow wound healing. In severe cases, diabetic ketoacidosis, DKA, or hyperosmolar hyperglycemic state, HHS, can occur, leading to life-threatening complications. The medical management of diabetes involves a comprehensive approach, including lifestyle modifications, oral medications, and insulin therapy. The primary goal of therapy is to achieve and maintain glycemic control while minimizing the risk of hypoglycemia and other complications. Insulin therapy is a cornerstone of diabetes management and is classified based on the onset, peak, and duration of action. Rapid-acting insulin analogs, such as insulin Lispro and insulin Aspart, have a quick onset and short duration of action and are used to cover meals. Short-acting insulin, such as regular insulin, has a slower onset and longer duration of action and is used to cover meals and correct high blood glucose levels. Intermediate-acting insulin, such as NPH insulin, has a longer onset and duration of action and is used to cover basal insulin needs. Long-acting insulin analogs, such as insulin glargine and insulin detemir, have a slower onset and a more extended duration of action and are used to provide basal insulin coverage. Other medications used in the treatment of diabetes include oral hypoglycemic agents, such as metformin and sulfonylureas, which increase insulin sensitivity and stimulate insulin secretion. GLP-1 receptor agonists, such as exenatide and liraglutide, are injectable medications that stimulate insulin secretion, suppress glucagon secretion, and delay gastric emptying. Nursing care for diabetic patients involves close monitoring of blood glucose levels, adherence to medication and diet regimens, education on self-management and prevention of complications. Nurses should also assess for and manage acute and chronic complications, such as hypoglycemia, hyperglycemia, diabetic foot ulcers, and diabetic retinopathy. Complications of diabetes can be acute or chronic and include hypoglycemia, hyperglycemia, diabetic ketoacidosis, hyperosmolar hyperglycemic state, neuropathy, nephropathy, retinopathy, and cardiovascular disease. Prevention and early intervention are critical in minimizing the risk of complications and improving the patient's overall quality of life.